People who come from all walks of life who need to use the Seattle King County Clinic. They have many different reasons. So we wanted to be able to share their stories as part of the work that we do with the clinic.
I'm 37 years old. I work for a small business. They can't afford dental insurance.
Comics journalism is using the medium of comics, but in this case, you're talking to people and then do interviews like a newspaper article or for TV, and then you are conveying their stories using the medium of comics.
When they share those stories with a comic journalist, these comics, these illustrated stories really have the ability to help better inform people about who's struggling to get care and why they're in this situation. Because a lot of times people jump to conclusions. One of the first conclusions people jump to right now is that people in need are people experiencing homelessness. With Seattle King County Clinic, 95% of our patients are housed.
Comics are fun to read. Although it might take you by surprise, you might think you're about to have a laugh, and instead you're like, oh no, this is actually a tragic story.
In another hour, I'll have dental surgery, an extraction. Without this clinic, dental is myself and a pair of pliers. I've done it before. It's not fun.
The reason why we were doing comics at all is to get people to look at the problems in different ways.
I have insurance, but they don't cover more than one a year.
These are real people, and they're real people telling their stories in the churn of this system. You can have what you think is good medical insurance until you really put it to use.
I've always had eczema my whole life. I saw a dermatologist and they sent me to light therapy, which was very effective in helping my eczema. Anyway, they changed healthcare plans in the middle of me getting these treatments, and I just was like, oh yeah, it's covered. Like, I didn't think that would change, you know. Now I know much better. This was me getting all my medical bills in the mail and trying to pretend that they didn't exist because I didn't have the money to pay them. One of the things I really love about comics is that it makes subjects that are hard to talk about or taboo or, you know, difficult for whatever reason, a little bit easier to digest, a little bit easier to consume because it feels a little bit more harmless.
I like the comics medium because it's also emotional. We can convey a lot of empathy for what people are going through. We can hear what they're saying. We can also have thought bubbles that express what they're thinking. We can show the humanity in their face and really try and connect to people who are reading it who might have similar experiences. So I really like using that emotional part of the comics medium.
Call me Trombone Larry. I moved here after Katrina hit New Orleans. I need a crown or something to cover my broken tooth.
He had had some damage to his teeth, and because of that, he couldn't get his mouth into the right position to play the trombone.
Without that piece of tooth, I can't put the real oomph into the music. If you can't get that, what else you got?
For him, it meant that he would be able to go back to work playing music if he could get his teeth fixed. He was somebody I was able to get in touch with afterwards because I wanted him to see the comic strip I drew about him. And he was actually playing music again, and he was really happy about it. You know, that one sticks in my mind.
Janet. So she was part of our intermittent parking staff. She would come in when there were certain events. She had some dental needs that were beyond her financial capabilities, and so she was going to come and wait in line for a ticket and try to get dental care. So she came to the clinic on a subsequent day, ended up, I think, getting some crowns. As she was starting to make her way to the exit, somebody stopped her and said, "You look to be somebody who's about an age that may need a mammogram." And so she said, "You know what? My primary care provider has been suggesting this for a really long time. I've been putting it off. I'm going to go do it." And she did. And she told me that they diagnosed her with breast cancer in that mammography exam. You know, here was somebody who was working, but they just couldn't afford it with the type of insurance that they had. Janet continued to work at Seattle Center, and she came back for a number of years as a volunteer because she wanted to pay it forward. Unfortunately, in our 5th year, Janet succumbed to her diagnosis of breast cancer.
part of the responsibility of telling these stories is making sure that we actually do something with them, that we use it as a call to action, to advocate for better access to healthcare services.
We've started to include these comics in our final reports, and I ultimately learned I had to hold back these comics because they got so engrossed in looking at these that they wouldn't pay attention to what I was saying.
I think that's something that people need to get, is that the clinic as a Band-Aid on the system. These comics are just part of the larger cry for help to see that the people deserve so much better.
Watch City Stream Tuesday nights at 7 on the Seattle Channel, or find us anytime online at seattlechannel.org.